Hi, how are you? My name is Hassan Adnan Al-Usaybi, and today my presentation will be about surgery. Let's go ahead and start. First of all, we have surgery. Surgery is a medical specialty that involves the use of manual and instrumental techniques to treat a disease or injury. Like you can see in these two pictures, here are a surgery. So we have a lot of types of surgery, like plastic surgery, pediatric surgery, orthopedic surgery, and general surgery, and a lot of more. Then we have surgeon. A surgeon is a doctor specializing in the use of manual and instrumental techniques to treat a disease or injury. Like you can see in these two pictures, here are an example about surgeon. You can see here's a surgeon, he's making a surgery. So we can say a surgeon is a doctor specializing in surgical operation. And here are some tools that a surgeon uses during a surgery. First of all, we have scalpel. Scalpel is used to cut the tissue. Then we have clamp. Clamp is used to tissue constipation. Then we have suture is used to swab the wounds. Now let's talk about operation. An operation is an act of performing surgery on a patient. Like you can see in this picture, here are some surgeons making an open heart surgery. You can see in this picture, here is an open heart surgery. And now let's talk about open heart surgery. Open heart surgery. An open heart surgery is a surgical procedure performed to treat heart problem by directly accessing the heart through opening the chest. So during open heart surgery, the surgeon will cut through the breastbone and spread the ribs to access the heart. So an open heart surgery is a type of heart surgery that involves opening your chest well so a surgeon can reach your heart more easily. It is a way surgeon can reach your heart directly and treat the heart issue. Types of open heart surgery. Now we will talk about types of open heart surgery. Coronary artery bypass. Types of open heart surgery. First of all, we have coronary artery bypass grafting, CABG, is used to treat coronary heart disease, a type of heart disease that occurs when a plaque builds up in the coronary arteries that supply the heart with oxygen-rich blood. Then we have heart transplant, is an operation in which a failing heart is replaced with a healthier donor heart. Heart valve repair or replacement. When valves are damaged and do not work like they should, they may need to be repaired or replaced. An operating room is a room where surgical procedures or a treatment for like you can see in these two pictures, the operating room of the artery must be also called an aortic 100% to prevent infection among the patient. This means operating room. An operating room is a room where surgical procedures are performed. Like you can see in these two pictures, the operating room must be clean and sterile 100% to prevent infection among the patient. This means that the tools that will be used in the operating room must be sterilized before and after the operation, so that doesn't happen any infection among the patient. There are things that the doctors do before and after the operation. Let's talk about them. Like what I said, there are some things that doctor does before and after operation. Let's talk about before operation. Like you can see, pre-operation. If something is pre-operation, it means it occurs before a surgical operation. Like you can see in these three pictures, here is a doctor taking some tests for the patient before he go to the operation room. We have main pre-operation. First of all, measuring the patient temperature. Second thing, measuring the patient weight. Depending on the patient weight, the doctor will use the appropriate amount of anesthetic for the patient. Third thing, we have vital signs like blood pressure, heart rate, breathing rate. Then we have review patient history. We must know the family history to determine if there are any disease that may expose the patient to complications after the operation. Then we have blood type. Like you know, there are 4 blood types: A, B, AB, and O. It is important to know the patient's blood type so we don't give them the wrong type of blood, because when you give them the wrong type of blood, it may cause to death, because each blood type has its own specific antigens. For example, if a patient with blood type A were given blood from type B, they would die, because, as I just told you, each blood type has its own specific antigens. ECG or electrocardiogram. ECG or electrocardiogram is a test that records the electrical activity for your heart, including the rate and rhythm. Recovery room. A recovery room is a room in a hospital where patients are placed after they have had an operation under anesthesia so that they can be monitored while they recover. So we can say a recovery room is an area where patients go after an operation to recover from anesthesia and other effects of the procedure. We had talked about what doctor does before an operation, and now we will talk what doctor does after operation. We have post-operation. If something is post-operation, it occurs after a surgical operation. Like you can see in this picture, here is a doctor. He will have some tests for the patient to see if the operation was successful or if it had any complication. Here are some main post-operation. First of all, measuring the patient temperature. Second thing, measuring the vital signs like blood pressure, heart rate, breathing rate. Then we have level of pain and level of consequence. And now let's talk about pain scale and level of consequence. A pain scale is a scale from 1 to 10 that given to the patient to say how much pain that he feels. So like you can see in this picture, if the patient said from 1 to 2, that means no pain. If he said from 3 to 4, it hurts a little. If the patient said from 5 to 6, it hurts little more. If he said 7 to 8, it hurts even more. If he said 9, it means it hurt worse a lot than if the patient said 10. It means hurt worse. So when the patient said the pain level is 10, that he means the patient is feeling so much painful. Let's go to level of consequence. Level of consequence is A, V, B, U. A means the patient is awake, everything good, and he can go to his family. V means the patient responds to variable stimulation, so he can hear and he maybe can talk to you and like that. P means the patient responds to painful stimulation, so he can feel of pain. And this is the last level of consequence. U means the patient is completely unresponsible, so he doesn't know what he's saying, he doesn't know where he is, he doesn't know anything at all. So when the patient is unresponsible, they say to his family that he cannot see the patient right now. After he wakes up, they can see him. Any questions? This was my presentation for today. We talked about surgery and surgeon, and we maintained some surgical tools. After that, we talked about operation, and we maintain open heart surgery, and what are the types of open heart surgery. Then we talked about operating room and what the doctor does before and after the operation, and we know the difference before about pre-operation and post-operation. This was the end of my presentation. I hope you benefit from the presentation. I hope you enjoy the presentation. Thank you for listening and goodbye.